Right is right, and wrong is wrong, must be applied in the context of providing quality care to all individuals. In a society that often categorizes actions and behaviors as either right or wrong, it is essential to consider the complexities and nuances of providing quality care to all individuals, particularly young Black children who identify as LGBTQ. While it may be easy to fall into a binary way of thinking, it is crucial to recognize that each person deserves to be treated with dignity and respect, regardless of their background or identity. Journey with me, as we will explore some important points about the idea that right is right and wrong is wrong, while emphasizing the importance of extending quality care to young Black children who identify as LGBTQ. First and foremost, it is crucial to acknowledge that every person has the right to access quality care, regardless of their race, sexual orientation, or gender identity. Providing equitable care to all individuals is not only a moral imperative but also a legal one, as discrimination based on these factors is prohibited by law. This means that healthcare providers must ensure that they are providing inclusive and culturally competent care to all patients, including young Black children who identify as LGBTQ. Furthermore, it is essential to recognize that the experiences of young Black children who identify as LGBTQ may be uniquely challenging. They may face discrimination and prejudice both within their communities and in the healthcare system, which can have serious consequences for their physical and mental health. By extending quality care to these individuals, healthcare providers can help to mitigate the impact of these stressors and support them in leading healthier lives. Additionally, it is important to understand that providing quality care to young Black children who identify as LGBTQ is not about making exceptions or treating them differently than other patients. Instead, it is about recognizing and addressing the specific needs and challenges that they may face due to their intersecting identities. For example, young Black LGBTQ individuals may be more likely to experience poverty, homelessness, and mental health issues, which can impact their overall well-being. By tailoring care to meet their unique needs, healthcare providers can help to ensure that these individuals are able to thrive. Moreover, it is crucial to consider the role of social determinants of health in shaping the experiences of young Black children who identify as LGBTQ. These individuals may face systemic barriers to accessing care, such as lack of insurance, transportation, or culturally competent providers. By addressing these structural inequalities and advocating for policies that promote health equity, healthcare providers can help to create a more inclusive and just healthcare system for all patients. At the same time, it is important to recognize that providing quality care to young Black children who identify as LGBTQ also requires a commitment to ongoing education and training. Healthcare providers must be willing to engage in self-reflection and learn about the unique needs and experiences of these individuals in order to provide truly inclusive care. This may involve attending cultural competency trainings, seeking out mentorship from LGBTQ-affirming providers, and staying informed about the latest research and guidelines related to LGBTQ health. Furthermore, it is essential to involve young Black children who identify as LGBTQ in their own care and treatment decisions. These individuals are experts on their own experiences and should be empowered to voice their needs and preferences in the healthcare setting. By fostering a collaborative and respectful relationship with these patients, healthcare providers can help to build trust and facilitate better health outcomes. In addition, it is important to consider the impact of stigma and discrimination on the mental health of young Black children who identify as LGBTQ. These individuals may face a higher risk of depression, anxiety, and suicide due to the social marginalization and discrimination they experience. By providing affirming and supportive care, healthcare providers can help to reduce these disparities and promote mental well-being among this population. Moreover, it is crucial to address the intersectionality of race, gender identity, and sexual orientation in providing care to young Black children who identify as LGBTQ. These individuals may face unique challenges due to the compounding effects of multiple forms of oppression, such as racism, homophobia, and transphobia. By taking a holistic and intersectional approach to care, healthcare providers can better understand and address the complex needs of these individuals. Additionally, it is important to recognize the role of family and community support in the health and well-being of young Black children who identify as LGBTQ. These individuals may face rejection and isolation from their loved ones, which can have serious consequences for their mental and physical health. By working collaboratively with families and community organizations, healthcare providers can help to build a supportive and affirming network around these individuals, promoting resilience and positive health outcomes. Furthermore, it is critical to advocate for policies and practices that promote the rights and dignity of young Black children who identify as LGBTQ. This may involve supporting initiatives to increase access to healthcare, reduce disparities in care, and protect the rights of LGBTQ individuals in the healthcare setting. By engaging in advocacy efforts, healthcare providers can help to create a more inclusive and equitable healthcare system for all patients. Moreover, it is important to recognize the power dynamics at play in the healthcare system and work to address them in providing care to young Black children who identify as LGBTQ. These individuals may face discrimination and mistreatment from healthcare providers due to their intersecting identities, which can impact their willingness to seek care and trust in the medical system. By fostering a culture of respect and inclusivity within healthcare settings, providers can help to create a safe and affirming space for all patients. Additionally, it is crucial to consider the impact of systemic racism and discrimination on the health outcomes of young Black children who identify as LGBTQ. These individuals may face barriers to accessing quality care, such as lack of insurance, limited provider options, and discriminatory practices within the healthcare system. By advocating for policies that address these structural inequities and promote health equity, healthcare providers can help to create a more just and inclusive healthcare system for all patients. Moreover, it is essential to recognize the importance of self-care and well-being for healthcare providers who are working with young Black children who identify as LGBTQ. These individuals may face vicarious trauma and burnout due to the challenging nature of their work, which can impact the quality of care they are able to provide. By prioritizing their own mental health and seeking support when needed, healthcare providers can ensure that they are better able to support the needs of their patients. In conclusion, the idea that right is right, and wrong is wrong, must be applied in the context of providing quality care to all individuals, especially young Black children who identify as LGBTQ. By understanding the unique needs and challenges faced by these individuals and taking a holistic and inclusive approach to care, healthcare providers can help to promote health equity and well-being for all patients. Through advocacy, education, and a commitment to cultural humility, providers can help to create a more just and inclusive healthcare system that values the dignity and rights of all individuals. Remember, this could be your child, and it might be you, but it hits different, especially when it's close to home, and maybe in your home, and the only voice to speak is you. Right is right, and wrong is wrong, must be applied in the context of providing quality care to all individuals. 10 down WJ, where creativity meets impact.